Hello, everybody. Well, it's been a while, but here's what's up with me. I don't know if you can tell by my face, but it's been 2 weeks today since my surgery. I lost roughly 25 pounds. I gained about 3 pounds back, maybe 4 pounds back. I can't tell. So I went from 193 to one. Last time I checked, it was 173. So maybe I'm back down to 20 pounds lost instead of 25. So um, it's been a journey, I will say. It's not over yet, but I mean, to summarize what happened, went into surgery at 7:30 last Tuesday, 2 Tuesdays ago, the 6th. Uh, Surgery didn't last 3 hours, didn't last 4 hours, lasted almost 9 hours, 4 to 5 hours longer than a normal surgery like mine. So, of course, I didn't know it. My wife was petrified the whole time, and I wasn't aware because I was out. What happened was, um, he had some complications, but it wasn't major complications. He had to take a little bit extra. Well, he had to take some of my small intestine out also. A very little bit, nothing that's going to affect the outcome of my final surgery, but because he couldn't find good blood flow or to hook up whatever he was hooking back up. So that's where we stand there as far as that goes. Now, waking up from surgery was traumatic and nightmarish. When you're out that long, you have uncontrollable shakes. I mean, it's the anesthesia wearing off. It was nightmarish. I mean, I was doped up pretty good, but at the same time, it was hard to explain. A very bizarre situation. Very hard to understand what was going on. I was in the PACU unit, which was the recovery unit, for the better part of 4 hours, and for me, unnecessarily 4 hours, because after 2 hours in there, I was ready to see my wife. I saw what time it was. I knew she'd be panicking. I was worried about her. I didn't care about myself at the time. But they kept telling me your room's being cleaned, your room's being cleaned. And I'm thinking, how long does it take to clean a room? In hindsight, I go in the hospital in there 2 days. There's a girl comes in, a lady comes in every day, cleans your room, mops it, takes trash out, the whole 9 yards. It takes her 15 minutes. So 2 hours to clean a room. It was getting a little ridiculous. And then I waited another 2 hours for transport. I was to the point where I said to the nurse, can you push a hospital bed? Because I needed to see my wife. It was a better part of 9 o'clock in the evening till I finally saw my family. It's very traumatic. I mean, it's not what I expected. It's worse than I expected. Everyone's different. Everybody's experience is going to be different. It's been a journey. It's been a really rough journey. I mean, in the hospital, and as you saw when I was in there, I took some videos and put them on Facebook with my hiccups I was having. I had 20 separate bouts of hiccups. My last one, thank God, was a Saturday morning, which would have been the 6th, 7th, 8th, 9th, 10th, Saturday the 10th, I think it was. It was rough. There were bouts of hiccups. It wasn't just a hiccup. It was a side effect of the surgery is what it was. And not everyone gets that side effect. And it was just a hiccup. It was a hiccup and like multiple spasms after the hiccup. So it was very, very painful. I mean, my pain scale would go from a 2 to a 10. And sometimes it lasted 10 minutes, and there was times where it lasted 2 hours of hiccups. I passed out once from the pain. And when you're in that kind of situation where you have that much pain and nothing's helping. I mean, they gave me, pain drug. There is no hiccup shot. They were afraid to give me certain things because of side effects. Like Thorazine was one of them. They didn't want to give me that right away. And the one time when I have them for well over an hour, I pleaded with the nurse's aide, young girl, Sarah, her name was, really nice, just to come over and just hold me. I needed a human being in that bubble of pain I was experiencing. It was so traumatic because it was in the middle of the night. There was no family there, and you feel so alone, and the nurses over there were great, and the nurses' aides, and they were overworked, and it was kind of frustrating at times when I was going through a lot of pain and I needed something for it. And you hit the buzzer and no one comes because they're overtaxed. They have 7 patients for one nurse, and you're only supposed to have 5 tops. So it's a tragedy, and I'm not upset with the nurses. They did the best, and I had some really, really good nurses. I had one guy, Steve, he was great. Liz was awesome. Jen, the nurse's aide. Sarah. There was so many good nurses that helped me out. It was 6 days in the hospital. It was rough, First 2-3 days I had that catheter in, so I was pretty much, hooked up to all kinds of crap. I had a drain tube. I had my bag on. I had a catheter in. There were times where I didn't know where I was, and they wanted me to get up, a couple times that second day. I got up, I think once, walked the hall once, did one lap, sat laid back down, but one of the worst experiences is your back pain, and those beds are just horrible. And I want you to sit up in the chair, and so, by Thursday I was, sitting in a chair for a better part of the day, and I would get shots for pain every so many hours, and there was one point when I had the hiccups so bad that I was probably into the 15th bout of hiccups that they finally begged the doctor to give me something, and he did give me the Thorazine. I don't know, honestly, it was such a traumatic situation, I don't remember how it even worked, if it worked. Because the pain was so incredible. I think it did calm him down, but I think that one of the side effects with the Thorazine, I think, was fatigue or something like that, because I think I slept a little bit after that. But it was very traumatic, that whole hospital experience, and it's not what I expected. It was worse than I expected. A lot of things were worse than I expected. So going into it, I thought I was prepared. You're never prepared for that kind of situation. But when I came home Monday, it was a relief to be home, but another new set of challenges, just getting out of bed, making sure I move around. My blood pressure was low a lot at home that week because, just not getting enough fluids, and the first night trying to sleep, I only slept for 2 hours, and I couldn't figure out what was wrong with me. I couldn't sleep. I didn't feel fatigued. I didn't feel much pain. It was weird. It's almost like my brain refused to tell my body what was going on. I would try to close my eyes at night and sleep, and I would just feel my eyes underneath my eyelids just twitching uncontrollably. And I didn't know what to do. I couldn't sleep. I tried. It's not like I didn't. I can usually calm myself down, but it's a weird situation. I've never felt that before in my life. So I called the doctor. He prescribed some Xanax, and I'm not a big guy for drugs and pain pills and sleeping pills and everything, but it's an anxiety pill. So I took one, even though it said 1 or 2. I should have taken 2. I took 1, waited about an hour, and nothing happened. So I had the wife bring me up another pill at 10 o'clock that night on Tuesday night, and after I took that pill, I slept for the better part of 12 hours. I think I got up twice to go to the bathroom, but other than that, it was a very brief moment up and then backed out. I was out. I needed that sleep so bad, because you don't sleep in the hospital. You really don't. And they're not excuse, but they're saying pretty much is you're here in the hospital. You're here to heal you, not to rest. You go home to rest, and they're right. I took the Xanax a couple nights after that. Just one, just to help me sleep, and I haven't taken one since, so I've been able to sleep on my own, no problem since then. But I have them in the event that I have any issues. But there's that second surgery which is looming on the horizon. But I got the nurse coming over today between 11 and 1. I'm still not allowed to drive. He gave me this whole test that I gotta be able to stand up on my tippy toes and then slam my heels down. And if I don't feel pain anymore doing that, then I can drive, because that simulates someone pulling out in front of you and you slam on the brakes. Your reaction time, if you can't react fast enough, then that's a problem. So I'm having people drive, if I got to get to doctor's appointments, such as that. So I think that's all I got for today. I'm sorry it's been a while, but I haven't been really in any condition to make a video that would be coherent since the hospital Facebook ones. I've just been so tired, and he took the staples out yesterday and put these butterfly bandages on. Now I have 2 holes that I don't have to stuff gauze in anymore. It's my lower incision ones. I have to just cover it with a gauze and tape it over, and it will heal from the inside out, he says. I can't imagine how. It's pretty disgusting looking, but I'm getting used to that kind of thing now. You have to deal with it, because it's one of those. It will get better. It will heal. The bag will go away. It's just got to be patient. It's just tough doing things like that. But I'm just grateful that I have lots of friends and family taking care of me and watching over me and looking out for me. So again, I appreciate all your support, guys. Please subscribe to my channel if you could, please. I think that's all I have for today. I'll make another video tomorrow. I'm sure there's stuff I forgot to tell you. So that's all we got. I'll speak to you guys tomorrow. Have a great day. Thanks.